Welcome to the Gum Guru, the podcast where we talk about all things gums, implants, and oral health. In each episode, Dr. Macon Singletary of North Raleigh Periodontics shares tips to keep your teeth and gums healthy.
Welcome to the Gum Guru podcast. Thank you so much for being here with us today. I am Jason Kong alongside Dr. Macon Singletary, and we also have a special guest with us here today, Dr. B. Dr. Singletary, how are you doing today?
Better than I deserve. It's a great spring day.
It is that time of year. You know, it's a great time to be here in North Carolina, and we've got a great show lined up today. But Dr. Singletary, why don't you introduce our special guest for today?
Yeah, this is Dr. B. He is a periodontist like me, a diplomat of the American Board of Periodontology. So he's been through all that torture that you got to do to demonstrate that you're over and above the standard periodontist. He's had a couple of years under his belt, but he's coming on board to our office and associating with us. And so, Dr. B, why don't you tell us a little about where you came from and what you like to do? And I know it's perio. I mean, that's your most favorite thing. That's why you're here, right?
Yeah. Well, thank you, Dr. Singletary. Thank you, Jason, for having me on. Like I said, my name is Dr. B. My full name is Ronak Bhagat, but you guys are happy to call me Dr. B. I'm really excited to be coming on with Dr. Singletary here. And kind of helping out with all things perio. But a little bit about me, I grew up in Vermont in my early childhood from there, and then traveled all the way from Vermont to Florida, where I went to Nova Southeastern University for my undergrad and dental school training. And then after that, I kind of bounced over to the Midwest in Iowa to get my perio specialty training in periodontics and implant dentistry, and also got my master's done there as well. And then after all that was said and done, I kind of settled right in the middle here in North Carolina. I have some family in the area, and so it just made sense to kind of move back and be closer to family, and you can't go wrong with North Carolina. So that's why me and my wife, we've enjoyed being here and kind of starting to call North Carolina home. So happy to be here with you guys, and thanks for having me on today.
Yeah, you got to get used to the pollen, right?
That's been fun seeing my car covered in the yellow, but we'll get there. We're almost through the pollen season, I feel like, so yeah, better days ahead, so it should be good.
Yeah.
You have been baptized in that way. So you'll get through the pollen, and, we'll get through a wonderful spring and summer here in North Carolina. But we've got a really interesting topic lined up for today. We're going to be talking about the silent killers when it comes to periodontal disease and what we can do about that. And Dr. Singletary, I've done this program with you enough to know that you have a famous saying that, when it comes to symptoms, when you start to notice things, you like to say it's curtains.
It's like high blood pressure and glaucoma. If it hurts, it's too late. Yeah.
So what do we need to know about some of these silent threats when it comes to our gums and our oral health?
Well, the most important thing is to pay attention. If it doesn't hurt, it doesn't necessarily mean that something's not going on. But understanding what causes gum disease is important. And we talked about it before. It's bacteria, it's plaque. And so you may not hurt, you may not see bleeding, but, I call it little sweaters on your teeth. If you can be aware of the fact that after you eat, you feel something that's, not part of food, that's the bacteria. And that's what you got to floss and brush off. And I always say 4 times a day, wake up, middle of the day, dinner time, and bedtime. It does sound crazy. But you do have a systemic influence. When you chew, you have bacteria showers in the bloodstream. It takes a minute to go from your mouth to your toes. So there are 11 species of bacteria that can do things that can affect your brain, your heart, joints. Dr. B's, his specialty was along that line of microbiology. So what do you think? I mean, as far as silent killers, your thoughts on that?
Yeah, I think like you'd mentioned, the nice thing about periodontal disease is you don't know you have it until you have it. Because 9 times out of 10, it is not going to hurt. And like you guys had mentioned, it only hurts when it's kind of at that very end stage that you cannot, your treatment options are limited. And we do our best to try to help save those teeth at that point. But the simple things in terms of keeping the silent killers at bay is just, make sure you're going in for the dentist at least twice a year for an exam, making sure you're getting x-rays done routinely to kind of check where those bone levels are at, making sure that bacteria destruction hasn't actually started without you knowing, and you may not feel it. It's that low-grade chronic inflammation, similar to what you'd see in heart disease. And I think this ties into kind of those silent killers being silent killers not only in your mouth, but the link to the systemic health. You know, we know diabetes is linked to causing periodontal disease. Smokers have the cause of periodontal disease. A lot of studies from over 20 years ago and now becoming more confirmatory of the link between perio and heart health, link between perio and rheumatoid arthritis. So it's one of those things that if you had it, it didn't just happen overnight. It's been going on for years and years. And so just like anything, the earlier you detect it, the easier it can be prevented and maintained versus if you find it later on down, you know, in your lifetime or when the destruction is much more. That doesn't mean it can't be resolved or saved. It can be, and that's why you come to us to help figure that out. But, you know, it just requires more attention and detail at that point.
Yeah, and that attention to detail, I think, is on so many people's mind because as much as we love you, Dr. Singletary and Dr. B, you know, we kind of want to avoid you as much as we can if possible. But let's talk a little bit about what we can do. I mean, we've gone over some things, brushing and flossing 4 times a day, which, you know, sounds like a lot, but, you know, if we're already brushing and flossing twice a day, you know, 4 more minutes to your day is not a monumental ask. And then making sure we're getting those regular checkups. But what else is in our court in terms of being a patient that we can control to help avoid periodontal disease?
Yeah, that's a good question. And I call it the pyramid of susceptibility. Some people are more susceptible than others. As you inherit the makeup of the saliva, you inherit your immune system. Guess what you don't inherit? The bacteria. So we're sort of right back where we started from. But yeah, I tell everybody that comes in here, you know, and we are busy. We have things going on. We have medical issues. We have surgeries. But the thing is, guess what's free? Flossing and brushing. Guess what's not free? Us. And so it is a habit change. But if you can get into it and understand that you're not just oral health, it's systemic health too, you know, that's key. Now I believe in the KISS principle. Keep it simple. We can make recommendations for toothpaste or mouthwashes, but it's the physical manipulation that's key. It's the bristle of the brush, the thread of the floss. And yes, what we do here, and you know, I think what we try to do when a patient comes in, you know, we look at 3 things. You know, first of all, why are they coming in? You know, it's interesting. Some people come in and they've noticed recession. And most people will say, I got recession here, and that's why they come in. And even, you know, the dentist, well, you got some recession there. And if we do an exam, we look at the medical history, we look at the x-rays, and we look at the intraoral examination, which is not just the gums and teeth. We look at upper jaw, lower jaw, muscles, lymph nodes. We check everything, but patients tell us a lot when they walk in. You know, I had orthodontic therapy 20 years ago. Well, patients have orthodontic therapy. You don't put braces on people that have inflammatory gum disease. You put them on, they won't do it. They got to get the gum tissue healthy first. So most of the time, they're not susceptible to gum disease. They get the teeth straight, the bony housing a little bit, and they get recession. But when they come in here, we start looking. I mean, they may have some pockets in the back they didn't know, they didn't feel. So being aware of is important, but, you know, getting back to just things to do. You know, if they have manual dexterity issues, if they have rheumatoid arthritis or MS, you know, we add things that's appropriate. I'm very adamant about flossing and brushing 4 times a day, but I don't get too crazy on automatic stuff unless I see they need the help. I want to keep it simple. And you're in the middle of the day, you're driving around your car, you're not going to have your Braun or your Oral-B. You may have your toothbrush in the glove compartment. You can dry brush. You know, you don't have to have toothpaste. And you know, rinsing's fine. You know, it gets loose debris out. You know, some people say, well, you should. I tell patients, if you eat 10 times, floss and brush 10 times, and individuals come and say, well, and some of the ADA studies say, well, you really shouldn't brush right after you eat because there's acid pH. Yeah, there is acid pH. When you chew, the enzymes in saliva break down the food particles, and yeah, the pH goes down. Well, how do you counteract an acid pH? Base. What's base? Water. So switch with water and brush and floss.
I think it's really funny. We had a patient, I think just this past week or 2 days ago, where she kind of was joking with us and saying, you only tell us to brush and floss 4 times a day, right? So we end up doing it twice. And, you know, kind of laughed at it. I was like, okay, it's great you're doing twice a day of brushing. But in reality, once these patients start to understand like what is causing this gum disease or what is causing these oral health issues, and they realize that, like you had mentioned, just 4 extra minutes throughout the day, however you want to do it. It doesn't have to be perfect with toothpaste and a sink. Just getting that manipulation done, disrupting that bacteria, will make a whole lot of a difference. And so it's, we kind of joked with her to say, yes, kind of is that kind of over exaggerating the recommendation, but it's, if you can get there, you're then going to start to see the real results that can get you to a good oral health. And I think that's the easiest one. It is tough because it's a habit change. Again, going back to periodontal disease is a chronic thing that happened over a lifetime. It didn't happen overnight. So that's mostly because of that habit. And so if it's going to take another 10 years to fix that habit and get your habits to where we need them to be to keep everything at bay. But that's why, I think with perio, it's great that we get to have those lifelong relationships with patients and, joining the practice now and seeing these people that Dr. Singletary walks in and says, I've seen this patient for 35 years, you can only laugh because it's where do you see that nowadays, that a patient has that kind of trust in a place to keep coming back for 35 years because they know they're being treated well. They know that they're going to keep hearing the great advice. They're going to get, joked on by Dr. Singletary a little bit if they're at 3 and he wants them to be at 4, but they know that he's saying that from a good place because, he's seen the results. We see the results just from those patients that make that full commitment to that habit change and what that can do for them.
Yeah, it's rare to see this kind of longevity, but it's a testament to North Raleigh Periodontics and its commitment to its patients. Dr. Singletary and Dr. B, I want to ask both of you. We're talking about these silent symptoms that otherwise we wouldn't recognize really. What are the consequences of not getting these regular visits and ignoring this? It's easy to kind of stick your head in the sand and think, well, I haven't been to the dentist in a few years, or I haven't had a checkup in a long time, but I'm not feeling any sort of pain. So let me just ride this out. What are the consequences of not getting things checked out?
I'll start with that. I mean, I can think to 2 easy patients that I just saw within this past year. Funny enough, I feel like even though people hate coming to the dentist, most of the time they actually will come to the dentist more than they might go to their own doctor. And so one of the first things, when we see a patient, we'll go through their medical examination and kind of learn about, where their health history is at. And sometimes we might notice their blood pressure is elevated and we see them again, their blood pressure is elevated. It's just a quick screening that we're doing. And we might notice that they don't have a physician, but just even that, it's not really about oral health, silent killers, but just a quick screening on the person's own medical health, seeing that, hey, your blood pressure is consistently high. Maybe we should get you to a physician, start getting that treated. And that link with the systemic oral health then comes into play again. Another patient I had, on his medical charting said hadn't seen a physician since they moved to Carolina and whatnot. We're describing, starting to feel symptoms, bad taste, bad breath, noticing those things, the kind of the fuzzy feeling that Dr. Singletary had mentioned. Did a perio examination. Of course, pretty large, extreme periodontal disease. Really talk to the patient. I think spending the time that we do during our initial examinations to really, like Dr. Singletary said, look at their x-rays, get a full set of x-rays, do a comprehensive medical evaluation, comprehensive periodontal evaluation. I kind of pushed the patient to, hey, before we make a treatment plan for you, I would really want you to go see a physician. Turned out the patient was diabetic and he didn't know about it. Now, that's a huge thing that if that was missed or we went ahead and did treatment, the treatment wouldn't have been successful. The patient would have been so in pain and discomfort. It's kind of, if you miss that third leg of the tripod, everything's just going to collapse. But the patient was thankful that, he actually ended up going. He was resistant to doing it, but he went, started getting that under control, started getting the perio disease under control, and we saved him from losing a lot of his teeth and having much destructive health concerns. He was about 45, so kind of helping prolong that life with his teeth and his overall health.
Segue on that. We're trained. The head and neck is our territory, and it's not just oral health. The silent killers are, like Dr. B is saying. You may not know that you've got a diabetic issue. One of the things that we look at when we look in somebody's mouth, we look at the oral pharynx, we look at the tongue, and sleep apnea is a big factor in our population today. And if you're not going through the normal sleep cycles, it can affect your sugar level, it can affect your brain health, dementia, heart, AFib, and we look at that. So when we do an exam, as I said, we blend the medical history, x-rays, and the oral exam. But the medical history is important. I've been accused of diagnosing thyroid problems. Somebody came in and the doctor said, "What is Dr. Singletary diagnosing, thyroid disease?" Well, it's our territory. It's what we're supposed to do. But it's all contributory. If you're not going through normal sleep cycles, you're not healing, you don't fight the infection as good, and that's what we do. That's part of the procedure when you come in. The first appointment here, it's 30, 40. Well, it's about an hour long appointment, and we're looking at things that you normally, somebody, well, I'm just here for this. Well, yeah, we address an immediate issue, but we're looking at all the other things because there are a lot of things that you don't feel or know about that we're going to try to catch. Even the face, dermatology, basal cell carcinoma, things.
I had when I was in dental school, I had one of the faculty there had mentioned to me that a periodontist kind of is the equivalent of like your internal med doctor in the physician world or in the MD world, in that yes, you have your general dentist and such, but when you come to the periodontist, we're not only looking at the gum and the bone health around the teeth, but we also do see problems with the cavities and those things, and we take note of all those things, and we kind of have to put all that information together to then explain to the patient like where they are in terms of the periodontal health, the restorative health. We may not do the fillings and crowns, but we still consider everything to get the full, complete picture, and then we can help guide them along their path for better oral health from there.
And that would make sense that having a healthy mouth would lead to healthy overall health. It's all connected. We always have an action step when it comes to steps that we can take to make sure that we're taking these lessons from these episodes of your podcast. What's our action step for today?
You go see your dentist or your periodontist. You don't have to have a referral to a periodontist. You can call them up, and we know what to look for. We do check decay. We don't do fillings, as we're specialists, but we also can refer out. But in any case, if you haven't been to a dentist in a long time, go schedule an appointment, because there are things there that you don't feel to the last minute. Like I say, if it hurts, it's too late. It's like high blood pressure and glaucoma. It's curtains. You don't want to be that in that position.
Make sure you're not being impacted by some of these silent symptoms and silent killers. Make sure you schedule an appointment if this is something that you're concerned about, or if it's been a while, it's been some time, reach out to North Raleigh Periodontics. Dr. B and Dr. Singletary will take great care of you. Well, that's going to do it for today on this episode of the Gum Guru podcast. Be sure to subscribe and follow so you don't miss an episode. Thank you so much for watching and listening.
Thanks for watching. Be sure to like and subscribe so you don't miss more tips to keep your mouth healthy. Learn more by visiting NorthRaleighPerio.com.